Telling your story, a brief description of the story, rationale, and goal. So, during one of my clinical rotations, I witnessed a situation that has stayed with me and will continue to influence my practice as a new nurse. A patient who had a history of substance use had just given birth. Despite the challenging circumstances, including the fact she had used shortly before arriving at the hospital, my preceptor and an additional nurse approached her with remarkable patience, empathy, and professionalism. I chose this story because it opened my eyes to the true meaning of compassionate, non judgmental care, and I hope sharing it highlights the power of nursing leadership in moments that require both skill and humanity. Shortly after we arrived on the unit, a patient came in who had recently delivered her baby and had been actively using substances prior to her arrival. Instead of reacting with frustration or judgment, my preceptor and the additional nurse worked together seamlessly. They spoke to the patient calmly, they explained each step of care, and they reassured her during a very vulnerable moment. They treated her with dignity and respect, addressing her as a person, not as a diagnosis. Their collaboration was quiet but powerful. One provided clinical guidance, the other emotional support, both advocating for the patient in a way that felt safe and compassionate. The impact that this has had on me as a student nurse transitioning into practice. This experience challenged my assumptions and deepened my understanding of what holistic care really means. I realized that nursing isn't only about performing tasks, it's about meeting people where they are, even when their choices or circumstances are difficult. Watching my preceptor and the additional nurse work together reminded me that empathy is not optional in nursing, it's essential. It also strengthened my desire to be the kind of nurse who creates a non judgmental, healing environment for every patient. This moment changed my view of what effective nursing leadership looks like. Leadership isn't only about titles, it's shown through behavior. My preceptor demonstrated leadership by modeling patience, emotional control, and respect. The additional nurse demonstrated leadership by advocating for the patient and guiding the team with her knowledge. Their teamwork showed me that good leaders elevate both patients and colleagues, and they set the tone for compassionate care even in stressful situations. I will incorporate this into my professional practice as a new graduate nurse. I plan to carry this lesson with me by approaching every patient with empathy, regardless of their background or circumstances. I want to remain mindful that patients in crisis they need understanding, not judgment. I will also strive to demonstrate quiet leadership through my actions, collaborate effectively with the healthcare team, and model dignity and respect in all patient interactions. Ultimately, I hope to become the kind of nurse who helps patients feel seen and valued, just as my preceptor and the additional nurse did that day.